patients do not know what they have. And we believe that if Kaiser can't figure out what a patient has, they should at least allow a second opinion. They should allow that patient to go outside the Kaiser system and get a second opinion. Any other medical insurance program to provide mental health care. But Kaiser is refusing to take care of patients that need mental health care. And they have long appointments and they don't provide mental health care, which is a requirement. So one of the things that we are calling here today is for Attorney General Xavier Becerra, who's the Attorney General of California, to begin an investigation of Kaiser and possible prosecution of Kaiser executives. The CEO of Kaiser, Bernard Tyson, makes $16 million a year. Kaiser has billions of dollars in profits that they're making. They have massive reserves, and apparently they have money to spend $300 million for marketing at the Warrior Stadium in San Francisco. But they don't have the money to pay for a patient to find out at another system what's wrong with her.
Has been the victim of several botched brain surgeries, and one starting in March 2012 when she received a shunt in her brain. The surgeon that did it in Redwood City did not use a general surgeon as customary to insert the drain catheter from her brain into her perineum, into her wall of her stomach, and it became coiled. And they never found out until 3 months later when her brain had already collapsed. She was sent back from the rehabilitation 3 months after the surgery in June of 2012. That's when a on-call neurosurgeon found out that the catheter had been coiled, but he said it's too late, her brain had already collapsed. So, and then she was discharged home. 2 months later, she was transported here in August of 2012 by an ambulance, and they figured out that her pressure in her brain was too much, her intracranial pressure. They had to transfer her down to Redwood City Kaiser again to put holes in the top of her head called burr hose. Since then, her health has not been the same. Before, she was very active. We vacation as a family. As a matter of fact, 2 years before the 2012 surgery, we made a trip to the UK in 2010. One of our last few trips to the UK and Liverpool. My wife is a diehard Beatles fan, and we went to London and Liverpool. So my wife is really tough. She's a really tough person. She's went through several brain surgeries since then, and she's been able to come out of each one. This was taken Thanksgiving 2017, 2 months before she was she went to Kaiser Redwood City. When I took her to Kaiser Redwood City in late December 2017, she had balance issues and stuff. And the doctor said her, oh, I'm sorry, I got that mixed up. She went in for to replace a shunt in her brain because at 8 years old she had a shunt on the left side of her brain. Because she had a head injury as a child, and in January 2012, the neurosurgeon said that shunt no longer functioned. It functioned for 45 years, but no longer functioned. So he recommended a new shunt be put in January 2012, and that was the one that the catheter was coiled, that he was not aware of. And 3 months later, like I said, in June, she had to go back she was transported back from the nursing facility back to Kaiser, and when they found out that's when they found out it was coiled, but her brain had already collapsed. So 2 months later, she came here. She was transported to Kaiser again, August 2012, to put holes in the top of her head, burr holes, to relieve the pressure in her brain. Since then, she's had a couple of surgeries to relocate the catheter, the drain tube from her stomach to her atrium of her heart to maybe help with her balance. They were not successful. In January 2018, she had a surgery to put a new shunt on the top of her head, on the left side of her head. This one here, as you can see, this photo is very recent. It was just taken a few days ago. This is her condition now. About Thursday. This was taken Thursday. And you can see the bump on the top of her head on the left side. That's a new shunt. That new shunt was put in. We did not want the shunt surgery. What happened before the surgery was I took her to the neurosurgeon's office in Redwood City, and he says, "This is the worst I've seen your wife's balance. I'm going to have to admit her." I said, "Okay, good." He admitted her in late December, and we wanted, and it's documented in the medical records that I have. You're welcome to have a photo of them if you like. And it's documented by several doctors that we wanted her to go to acute rehab to get her strength back and improve her balance. Acute rehab is one level up from skilled nursing facility. So they do a little more intense rehabilitation, and it's for patients that need extra help. So we wanted, instead of another surgery, we wanted acute rehab. Kaiser said no. And a week later, we kept trying to get them to do evaluation of her again for acute rehab. They said, no, she's doing too good for acute rehab. I'm sorry, she's not good enough for acute rehab, but she's too good for nursing facility. Because acute rehab, they require a patient to have 3 months, be able to sustain 3 hours of therapy a day. That's speech therapy, occupational therapy, physical therapy. So she didn't have the strength for acute rehab, but she was too good for a nursing facility. So the neurosurgeon says, you either have to take her home or we'll try this surgery to put a new shunt in her brain. Hopefully it will help for her balance and gait. And that's all documented in the medical records. So the next day, at 1:35 in the afternoon on a Wednesday afternoon, the nurse and I took her for a short walk the day after surgery, and she said, "I'm tired, I want to take a nap." So we walked her back to bed. As we were laying her down to bed, she started having a seizure. That seizure lasted ultimately 40 minutes, because it took 15 minutes for them to find any of the 3 doctors that were supposed to be on that ward. Their names are Quasada, Patel, and Pombra. These were doctors at the Neuro Recovery Unit at Kaiser Redwood City. Quasada is spelled Quesada. Pombra is spelled Pombra. And Patel is spelled Patel. Finally, they were able to locate Dr. Pombra, Pombra. She came, I pleaded work because my wife was, by this time, seizing for 15 minutes. 4 nurses were in there trying to help us, and they couldn't even take a blood pressure because her arms were so rigid they couldn't put a blood pressure cuff on her to take her vitals. So Dr. Pombra called a neurosurgeon for help, telling the neurosurgeon, come, my wife, Peri, is having a seizure. He laughed, joked, he thought she was joking, he laughed and hung up on her. This is Dr. Sedrak, Sedrak. He's the neurosurgeon that did the surgeries the last few years on my wife at Kaiser Redwood City. He's a neurosurgeon, a brain surgeon. I found this out later because one of the 4 nurses that were in the room with us, after my wife was transferred to ICU almost an hour later, she came to me and said, Mr. Ho, you know why it took so long for your wife to get help? Because Dr. Sedrak hung up on Dr. Pombra when she called him for help, to come help because your wife was having a seizure. He never came. They had another neurologist come, but I pleaded with Dr. Pombra to send her to ICU, get her into ICU. She said, no, she'll be fine. We give her 1 milligram of Ativan, medication, the seizure was stopped. The seizure never stopped. Ultimately, she gave 4 milligrams of Ativan. 4. That's a lot of drugs. And 300 milligrams of Dilantin. That's anti-seizure medication. It's spelled Dilanti. And then Ativan is Activan, I believe. It's medication that they administer to somebody that is having a seizure. So when she went into ICU at 2:30, she had no choice but to get her into ICU. She went into ICU at 2:30. She was in a coma for a day and a half. I immediately called my daughters to come down to say goodbye in case she didn't wake up. They were down there that afternoon to and stay with us. So ultimately, she, because she's strong, she recovered. She left the ICU. This is, as a matter of fact, this is the picture. The next day, January 25th, 2018. See how swollen her brain is? This is in ICU when she had. This is actually 2-3 days later, after after she was in ICU. Her brain was still very swollen. So later on, they brought her to. She was sent to Kaiser Vallejo Acute Rehab. It's their own rehabilitation hospital inside Kaiser Vallejo. It's a Kaiser facility where they have doctors that treat critically ill patients and provide intense rehabilitation. So she was there for 2 weeks. They wouldn't give her any longer. The next day, they discharged her. I brought her home. She had a seizure the next day at home. And then I called Kaiser Vallejo. They said, no, we can't take her back. So I had no choice but call an ambulance to take her to Kaiser San Francisco. And so I had to fight with Kaiser San Francisco. This is February 2018, after the seizure, to have her go to a skilled nursing facility. That's actually, it's pretty good. It's called Pacifica Rehab in Pacifica. They told me, no, that's in San Mateo County. We can't approve it. I said, you do what you need to do to approve it. I want her to go to Pacifica. I don't want her to go to any of the substandard nursing facilities. She went to Pacifica Rehab. Let me get the laptop. I'll show you. Oops, excuse me. She went to Pacifica Rehab, and she walked out of there 3 months later. This is how tough my wife is. She walked out of Pacifica Rehab after 3 months of rehabilitation. And I'm bringing up my laptop to show you some pictures when she recovers. My wife has always been very active. We like to go out for walks. I'm retired. We go out for walks, 30-minute walks. We live near the VA hospital, so we go to the Veterans Hospital to walk and have lunch. And we're 60 years old, but we're the youngest people there because most of the patients at the VA that go to see the doctors, they're older vets in their 70s and 80s. So, and I was really surprised. Okay, but in July 2018, she left she left the Pacifica Rehab in June. In July, she was readmitted here to Kaiser San Francisco because I was told she had balance issues again, but it wasn't her brain. It was, they said her electrolytes, her fluids were off. Can you just hold this? Her fluids were off. And she was here for a little over 2 weeks, and she walked out of here. She went home and walked out of here. But I was told, no, I just want to, I was told on the first day that she came here by a neurologist who said, the next day that after she was admitted in emergency, did you know your wife has a brain tumor? I wasn't surprised, because my wife, until now, has had, as of today, she has had approximately 130 CAT scans and x-rays. CAT scans of her head and x-rays. That's a lot of radiation. And so I wasn't surprised when the neurologist told me, your wife has a brain tumor, but let's not deal with that now. Let's figure out why she can't walk. She has trouble walking. So luckily, they said it was fluids. They adjusted her electrolytes. She was able to walk out almost a little over 2 weeks later. But at the end, interestingly, at the end of her stay here, July 30th, the same neurologist came up to me and says, oh, it's not a tumor. Exactly. She saw it on an MRI and she said, it's not a tumor. So in October, my wife, in August, we went out, exercised. She was doing good. In September, she fell ill again. We came to the ER 3 times. They never admitted her. In October, she was really bad. And so I had the ambulance transfer her to Redwood City Kaiser, thinking it was a neurological event, something with her brain. She's got 3 shunts in her brain, one behind each ear, and the new one on top of her head that was put in January 2018. So in October, when we went to Kaiser Redwood City, they found that she had pneumonia, fluid in her lungs, infection. So after about a week, the doctor named Christopher Chin at Kaiser Redwood City, last name is Chin, they wanted to discharge my wife, and she was still ill. And she complained every time he came in. She complained to him about her throat hurting for 4 days. Dr. Chin, my throat hurts, my throat hurts. And on the afternoon of the 4th day, she began to cough. And he said, there's nothing to be done for it. It's just a virus. I said, can you take a throat culture? No, the x-ray last week, the chest x-ray last week was fine. She doesn't have pneumonia. There's nothing to do for it. It's just a virus. He gave her Robitussin for her cough. And the next day, because my wife needed blood transfusions, they were going to do a bone marrow biopsy because her body was no longer producing red blood cells. So Dr. Chin, even though both her lungs were full of fluids, had sent her downstairs to do a biopsy for her bone marrow, which involved her, because she had trouble breathing, which involved her laying flat on her stomach. Fortunately, the doctor, his name is Amin, A-M-I-N, at Kaiser Redwood City, the doctor that was going to do the biopsy, took me into office and said, Mr. Ho, your wife is too sick. She has trouble breathing. We can't safely do this biopsy. We went back upstairs. Dr. Chin said, we have a bed for your wife at Jewish Home Nursing Facility. She can continue antibiotics over there. I said, no, she's not going anywhere. I would not let her be discharged. The next day she was so bad, she had to be transferred to ICU. And this is what happened a week later, ICU Redwood City. This is November 2nd when she went to Kaiser Redwood City ICU, when she was transferred into ICU again. When she went into ICU, I told the doctor there what had happened when she was being treated by Dr. Chin. He shook his head, but he would not criticize Dr. Chin. He looked at the x-ray and he told me, Mr. Ho, your wife is critically ill with pneumonia, double pneumonia. Both lungs were full of fluids with double pneumonia. Subsequently, he extracted, putting a needle in the back of the lungs. I don't know what the procedure is called.
You can't see that with the light.
Oh, okay. He did I think a lung puncture from the back and took out 1.1 liters of dark green fluids from my wife's lungs. Can you imagine that? So that 1.1 liters I'm sure took a lot of time to build up. Dr. Chin never took the time to do a throat culture to see if there's an infection, to do an updated chest x-ray the days that we were complaining. He said the x-ray looked fine, the chest x-ray last week looked fine. So Dr. Midei did a throat culture and confirmed that it was positive gram bacteria. And they had to put a tracheostomy tube, a hole in my wife's throat, to put a tube down her throat so that she can breathe. They have this up there. It's to monitor her for seizures. She was having seizures still. And she was on a ventilator machine to help her breathe. Actually, the trach came later on. This was a ventilator. It's a tube that they force down your throat to force your throat open so that air can be pumped in. And she didn't get her trach till later because they had to stabilize her first. So 3 months, she was in ICU for almost 3 months. And they sent her to Kentfield Hospital in San Francisco. Kentfield Hospital is on top of St. Mary's on Stanton and Fulton. It's they have the top floor of St. Mary's Hospital. They're a acute hospital that take care of patients like this. And the picture here, she was there in January. In February, she never had a vomiting any problems before. In February, she started vomiting every day for unknown reasons. She was vomiting so much that she was vomiting multiple times a day, sometimes 300-400 cc's or milliliters every day. And the doctors there could not figure out why. But what I am thankful that Kentfield did was they gave her excellent therapy. Here you see her still with the tube in her throat. She was going to therapy every day, 5 days a week. She was sitting independently on the side of the bed by herself. She's no longer doing that today. Today she cannot even stand up. So 2 weeks after this picture was taken, Kaiser San Francisco realized it was costing them too much money to pay for her care at Kentfield. My wife also had a sitter around the clock that Kaiser paid for while she was at Kentfield, and she had a sitter at Kaiser Redwood City when she was at Kaiser Redwood City. She had a sitter 24 hours a day in case she had respiratory problems, which she was having, and vomiting. So on May 9th, Kaiser took her back. Dr. Fung, her doctor, Kelly Fung, she's across the street, F-U-N-G, emailed me and said, we are going to take her back to better manage her care. I said, well, the medical director at Kentfield Hospital, Dr. Crenshaw, told us, we can't figure out why your wife is vomiting, but have Kaiser do a full GI motility workup, a full GI review to see why she's vomiting. She's welcome to come back once Kaiser figures out why she's vomiting and can solve the vomiting issue to resume her recovery. When she came back, initially they were so confused. They said they were talking to the neurosurgeons in Redwood City. She was going to go down to Redwood City because the neurosurgeons think it might be neurosurgery related. The next day, they said, no, let's just bring her back to Kaiser San Francisco. She was here on the evening of May 9th. The next day, on May 10th, and I told them that Kentfield Hospital, and they are aware that she needs to have a full GI motility evaluation. The next day, the head of the GI department came while I went to get lunch. When I came back, I was told by Dr. Jackson that Dr. Craig Monroe, M-U-N-R-O-E, came by to see you and said that nothing needs to be done with my wife to just treat the symptoms of vomiting. I said, what about the GI motility workup? She says, well, that's what he said. I called him. He never returned my call. My wife was here for almost a month later, June 7th, until another GI doctor was sent to examine her. The first time they did examine her. He suggested, his name is Mukhtar, M-U-K-H-T-A-R. He suggested a multidisciplinary meeting with different doctors, which took place that following Monday on June 10th. I had arranged with her neurosurgeon to call in on a conference call during that meeting. He did not want the neurosurgeon to be called, so the meeting took place on Monday, the 10th, without her neurosurgeon. Because Dr. Mukhtar said, the GI doctor here said, her problem is GI related. Before that, she didn't have a problem with the excess oral secretions, but one of the doctors that was in the meeting too, her concern was the same as mine. Her name is Dr. Lee Allen. She said, I'm not convinced that it's GI related, her vomiting. She's had other issues. So 2 days later, because he said, by this time she couldn't swallow. She already had a stomach tube when she left Kaiser Redwood City, feeding tube. So he says, add another tube into her small intestine so that she can get liquid feed. And he said, that will stop vomiting. The vomiting continue. And because I had asked at the meeting on June 10th for a GI motility expert to do a full evaluation. He says, we don't have a qualified GI motility expert here, but I know of a Chinese doctor named Lin at CPMC, Cal Pacific Medical Center, and Stanford may have one as well. But I'm more than happy to facilitate, to arrange a evaluation by the outside doctor if she continues to vomit. Well, on June 12th, she had that tube in her intestine and she continued to vomit. So I asked for another meeting because we were not getting anywhere. Nothing else was being done for my wife, so I asked for another multidisciplinary meeting on June 20th. Keep in mind that the ombudsman that's supposed to help you with the hospital, between you and the hospital, he was in on the first meeting. They are no help. They are part of management. He was in on the second meeting. Just before the second meeting, he asked me, why did you call this meeting? I said, because my wife is still vomiting and you guys can't figure it out. Do you know I had doctors on her care team tell me, we can't figure out, privately tell me, we can't figure out why she's vomiting. None of us can figure out. Demand that she gets outside medical evaluation from the top down. Neurosurgery, neurology, ear, nose, and throat, GI, and any other medical issues that may be affecting her. But privately, he told me that, but of course publicly in front of a supervisor, he won't say that. But interestingly enough, the first day that Dr. Mukhtar, the GI doctor that came and saw me June 7th in Peri's room, He was the one that suggested having multidisciplinary meetings with different doctors. He told me at the head of my wife's bed, "You're doing the right thing. If she were my family member, I would fight for her. I would not let her be discharged until the vomiting is resolved." So on the 20th, Dr. Sidrak, her neurosurgeon, called in. He offered to do all these things, to come up and do some evaluations, to tap her shunt, to draw fluids, to examine to see if there's a blood, some kind of infection in her brain that may be affecting it, and also suggested doing an updated MRI, because the last MRI was not done after November 28, 2018. The last MRI was November 28, 2018. So we're fast forwarding now to June 20th, 2019. So 7 months, there was no updated MRI. So he suggested doing an updated MRI. So the ombudsman said he would facilitate getting the doctor up there, getting permission for him to come up from Redwood City to do the shunt tap. A day later, I emailed her neurosurgeon, "When are you coming up to do the shunt tap?" He said he was told by the doctors here there's no need to do it. On the 26th of June 2019, we had a meeting in Peri's room, in my wife's room, with the ombudsman, Dr. Deborah Chiarucci, Chiraucci. At that time, there was also a discharge coordinator there, someone who would coordinate discharge if she were to be discharged. I was told she will be discharged to a skilled nursing facility. I said no, she's still having a lot of issues with vomiting every day and increased oral secretions. She still had a sitter by her bed, suctioning her constantly. So subsequently, the meeting adjourned with no other outcome. But I met with Dr. Muhtar and the ombudsman right after the meeting. Dr. Muhtar was there. Oh, I'm sorry, he wasn't at the meeting, but a half hour later at 12:30, I met with Dr. Muhtar. And I said, "You indicated that GI was causing her vomiting. You were so adamant that you would not allow other evaluations to be done, like neurology." He said, "So at the time, with the information I had, that's the decision I made." I said, "You also said you would facilitate an outside GI motility expert for evaluation." He says, "Well, if she continues to vomit frequently, I will do that." I said, "What guarantee do I have? You said you would before." So he documented in an email to me, which I have, that if she continues to vomit frequently, I said, "What's frequently?" He says, "More than a few times a week." He would facilitate an outside appropriately qualified gastrointestinal motility expert, either from CPMC or Stanford. So I got that email from him about July 3rd. She's still vomiting. I didn't hear from Dr. Muhtar. I don't hear from any other doctors about what's going to happen. They're all remaining silent. So I email the ombudsman, David Korth, Korth. I said, "Can you help me?" Because he was in on a meeting with Dr. Muhtar on June 26th at 12:30. "Can you help me facilitate outside second medical opinion because she's still vomiting?" He never replied to my email. And my email also said, "If you can't help me, let me know so I can go outside and get some help." Half an hour later, I get a voicemail from Dr. Muhtar. The same thing that he said before in past incidents when she kept vomiting. His voicemail said, "I still have it on my phone. I've discussed it with my colleagues. No further tests are needed." and she's still vomiting daily. And as a matter of fact, last week, one instance of vomit, one of two, was 500 milliliters, 500 cc's. And if I'm not mistaken, that's half a liter almost. But anyhow, about a week later, I emailed the CEO of Kaiser, Bernard Tyson, telling him what has happened and ask him for help. He said he would have somebody contact me. Nobody ever contacted me. I take my wife out of the hospital, out of her room. I try to take her out of the room in a wheelchair for an hour every day so that she get out of the room either to the window, or if she feels up to it and if it's not windy and not cold, here. And one day I came down and sat her in a wheelchair with this. This is on the 19th of July. All kinds of Kaiser managers came out and said, oh, let's talk about this. Because I wanted to point attention to how they're treating her. So when I went to the meeting with the ombudsman, another discharge manager, and the chief operating officer of this hospital, Dion Miller, Dionnemiller. She said, the doctor said your wife is medically stable to go to rehab. I looked her in the eye. I told her I disagree. I looked her in the eye and said, how can you discharge somebody who your doctors can't even figure out why she's vomiting every day? We trust our doctors. I said, I want an outside second medical opinion that you guys had agreed on. No, we trust our doctors. I was told that if you want a second medical opinion, you will have to pay for it. So as of the 19th of July, she was discharged, but I refused to let her be transported anywhere. I filed a complaint with the California State Department of Managed Healthcare, DMHC, Department of Managed Healthcare. They license all the health plans like Kaiser, Blue Cross, Blue Shield. They license the plan itself. They did an investigation and they got Kaiser medical records and notes that I had, date and time of notes and stuff and her condition, because I didn't trust Kaiser to keep an accurate log of her vomiting. So each day I come, I find out her condition and I keep an accurate log of her vomiting. They overturned Kaiser's discharge. They said it was medically necessary that she remain in the hospital. Since then, Kaiser has begun to do a few more tests, but they never did the GI motility tests. But they had doctors come see her. I asked for a cancer doctor to come see her. Cancer doctor saw her and said, there's no cancer anywhere in her body. When she was at Kaiser Redwood City in October last year, I showed the Kaiser doctor that came. It was a hematologist, a blood doctor, because she needed transfusions. I showed her the list. By then, at that time, it was only about 118 CTs and MRIs she's had in the last 6 years. CTs and X-rays. So her jaw just dropped. She said, I said, yes, this is from your radiology office. This is not something I made up. So she was very concerned. And that was when the neuro-oncologist, the brain cancer doctor, looked at the MRI of her and said the spot in her brain was growing. The bright spot in her brain was growing, but we can't really, because she's too ill, I can't tell you if it's a live tumor or malignant unless we do a biopsy, but she's too ill for us to do a biopsy. And he says nobody can tell you if it is or not. So anyhow, so after the overturn of the discharge by managed healthcare, they remained silent. They began to do a little more tests. They had the cancer doctor come. The cancer doctor said she doesn't have cancer anywhere in her body. So I wanted the oncology doctor. I wanted a repeat MRI and oncology doctor to come to review the MRI and look at her. They said they called a neuro-oncology doctor in Kaiser Redwood City. There was no updated MRI yet. The last MRI he was looking at was November 2018. He magically told them, I didn't talk to him. I was told that they talked to Dr. Peak, Scott Peak, P-E-A-K, that it is not a brain tumor. I said, that's funny because the email he sent me October 22nd, 2018 said it's not, he can't be certain until a biopsy was done. So anyhow, we were trying to arrange a way to get for my wife to get safely down to Kaiser Redwood City for MRI. The doctors here won't do it because she's too much of a risk. In case something happened, there was no neurosurgeons here. So Dr. Allen and I were discussing ways to get her to safely, medically safely do MRI. Instead, because they don't count on me getting medical records, I get medical records even while she's in the hospital and every time after she's discharged. It was documented that I refused an updated MRI. Even after Dr. Allen said, I'm going to have to talk to the Kaiser Redwood City and let me talk to the anesthesiologist here to see if maybe it can be done safely under anesthesia. So make long story short, August 20th, they transported my wife down to Kaiser Redwood City. They were rushing through everything. Within 15 minutes, another neurosurgeon came into the room and started doing a shunt tap because they want her out, in and out, back here. The shunt tap, the fluids that they drew, went to the lab, came back with 6 times the normal protein that should be in your CSF fluids, the brain fluids, 6 times the normal level. I think the normal hers was 250 something. I think the normal was like 40 something or 50. It was 6 times. But he said, it's fine. An MRI was done the next day. He came to the recovery room after the MRI, talked to my wife and I, said the MRI looked fine. I said, what about the brain tumor? He says, there's no tumor. I said, I want Dr. Peak to look at Scott Peak, the neuro-oncologist, to look at the MRI. There's no tumor. I make the call. If there's nothing, I'm not going to ask him to look at it. So he refused to let the neuro-oncologist look at the latest MRI that he said was growing last year. So since then, when she came back the next day on the 23rd, she was transported back here August 23rd. She fainted. She passed out twice, 90 seconds. And they couldn't even arouse her. She had a regular heartbeat, I was told, and she fainted. And she was not arousable for 90 seconds. I did not get a phone call. I did not get notified, neither did my daughters, that she fainted at 6:30 in the evening, and she was moved to the floor that she's at now, telemetry unit to monitor her heart and stuff. I was never told, but all hours of the day I call in. Sometimes I come by. I came by at midnight, and that's when I found out she was upstairs.
So you're asking the second opinion to the hospital.
I'm asking Kaiser to pay for a second opinion at Stanford Hospital for neurosurgery, neurology, ENT, GI, neuro-oncology, and oncology.
And what's the reason they're giving you the...
They're given the reason that we trust our doctors. Our doctors have said nothing needs to be done. Even though the doctors tell me they can't pinpoint, they point to each other, they can't pinpoint the cause of her daily vomiting. I called this morning at 2:30 to talk to the nurse to see how she was doing. And as I was talking to the nurse, she says, your wife, they just told me your wife vomited. I have to go in the room. I said, okay, thank you. That was Portia? Yeah, did you hear that? Yeah, at 2:30 this morning. Yeah, while I was talking to the nurse.
Did you file another complaint?
I filed another complaint because I filed a complaint against Redwood City Kaiser for what happened last year. They, the health department doctor came and went down there, investigated, and said they will be cited. They found some cited and fined. But I also filed a complaint here with the health department, and in July, and they found some irregularities with the record keeping, with the charting, the information that was going in the medical charts for my wife, and they cited Kaiser. I have the letter, if you like to have a copy, that my complaint was sustained. Yeah, that they cited Kaiser, and they in end of July they had beginning August, they told Kaiser within 10 days of the notice they have to provide a plan how they're going to remedy their deficiency. I want to call on the governor, whom I know. I know Gavin Newsom. I knew him since he was a supervisor when he was running for mayor, and I called him Mayor Newsom. This is down at Asia Garden, the fundraiser in Chinatown, and I shook his hand. I said, nice to see you again, Mayor Newsom. He said, Ken, you're the only one that calls me mayor. I said, because I know you're going to be mayor. Right now, my priority is to save my wife. And let me tell you the latest thing that they did. On August 28th, okay, the day before, actually since her, this is important, since her jejunum tube was put in her small intestine, they've had to replace it 3 times. One time it became clogged, 2 times. She vomited so much that it came out of her intestine into her esophagus, and one time into her stomach. So they had to go put it back. The last time it came out was on July 28th. I'm sorry, on August 28th. The next day, they had another manager who is the chief executive officer of this hospital. His name is Ron Groepper, Groeppa, met with me. This is the next day after she had the surgery the night before. He said, I don't want to hear anything about what happened to your wife. I know exactly what's happened. Your wife has been here too long. We know exactly what's been going on. I know all her medical issues. You don't have to, I don't want to hear it. Because I try to tell him why she's like this. He says, you caused this organization upheaval. I want your wife out by Friday, 5 p.m., before the Labor Day weekend. This was Wednesday.
So basically,
He said, I want this taken care of Friday. We're going to send her to Jewish home. I want you to agree to it. I want this accomplished by Friday, 5 p.m. This is just before the Labor Day weekend. So I filed another complaint. Since then, I filed another lawsuit with the Department of Managed Healthcare, and a second complaint with them. They're reviewing the discharge, but I've already gotten bills from them every day. They're even, these last 2 weeks, they're even billing me when she has stomach pains, for medication, for a stomach x-ray, for chest x-ray, which is normally covered by the hospital, because I have my retirement, my copay is $0 for hospital stays, covers everything. And they're billing me because they said 28th your wife was discharged. since she's here. Even oxygen. One couple of days she needed oxygen. They're billing me for oxygen, billing me for X-rays, and for medication. So, the last bill they gave me was on the 11th, and at that time it was $99,000. So they haven't given me. I haven't been here for them to give me a bill, but I told them give me one updated bill, one bill, not a bill every day. So. So Department of Managed Healthcare, because it's so complex, so much has gone on. They've got all the medical records, all the notes for me. They're sending it out for independent medical review again, to have doctors look at the discharge, and they're also going to see if they can make compel Kaiser. They have, by law, they have the authority to compel Kaiser to pay for an out-of-network. Also, 2 weeks ago, I was, because my wife gets sad a lot, and somebody had filed a complaint with member services that my wife needed psychiatric care. I didn't even know, I didn't file it. And I got a call from a director of psychiatry at Kaiser Redwood City saying, we got a complaint that your wife needs. I said, she does. That's a good idea, she needs a psychiatrist. So she says, her name is Linda Thornton, Thornton, Director of Psychiatry, Kaiser Redwood City. She says, I'm going to message one of the doctors up here, psychiatrists, to come see your wife. The next day, nobody came. I called her, she didn't answer. I left her a message, voicemail on her phone. She's not called back. No psychiatrist has come and seen my wife. And so, right as it stands now, she's still discharged. Last week, they were playing games. Last week, Mr. Groepper sent a messenger, said they want to meet with me to talk about discharge again. And I told the discharge person, I said, he's proposing a meeting? They said yes. I said, give me a written agenda. Because the last meeting I went to was supposed to be about a second opinion, and instead I got a bill from him, a letter that you're responsible, on the 28th you're responsible for all the charges.
I'm sorry,
Yeah.
I need to go.
Okay,
It hasn't
okay.
been too long.
Yeah.
So I have a few more questions.
Go, sure.
So were you the city employee? That's why you
State.
have
No,
insurance
state,
with
state.
Kaiser?
State.
State?
Yeah.
So did you talk to the insurance, company?
This is they are the insurance. Yeah.
I'm talking about the employers. If they
No, the employees have nothing to do with it because it's CalPERS. Yeah. They have nothing to do because they pay for the insurance, and then Kaiser administers the care.
Okay.
We know your story pretty complicated.
Yeah.
Okay.
We want to know what's your top request.
Okay. She cannot get a second opinion. She cannot get a second opinion, which they should do, and which the state should require. We're also calling on Xavier Becerra, the Attorney General of California, to do an investigation of Kaiser.
Did you ask this,
We're going to send a letter to him to ask that he make an investigation of Kaiser and the executives, because they have $21 billion surplus.
Numerous times when I've been here, they've always been short on nurses. Like last night I was here, and she doesn't have a sitter with her 24/7 anymore.
They retaliated.
And so the nurses, last night we took her into a chair to sit her in the lobby to get some air. And when we took her back, the two techs that I had took her diaper off, put her back in the bed, and then just left her there. But I asked them, I said, why don't you just leave the diaper on her, because they need to put a catheter in her, but only a female nurse can do that. So while I'm there, it took them about 10 minutes to finally get a female nurse to finally come in. And while she was walking in, she was complaining and saying, oh, we're so short-staffed. This is really hard to do. And so she was visibly irritated that, they were short-staffed.
And then another thing I hear from the nurses and the PCTs is that they are so short-staffed. And Kaiser, because of all the decisions from the health department and managed health that I won, they retaliated against my wife. On September 9th, the nurse manager named Ruth on 6th floor told me, we're taking away the sitter from your wife. I said, she's got respiratory issues. Your nurses even says it's unsafe for her to be without a sitter. We're going to monitor her once every hour.
So the problem is also not just Kaiser, it's the whole healthcare system in California and the United States. These insurance companies are more interested in their profit than they are in taking care of patients. They should have a right to a second opinion. Under California law, they're not enforcing that. And the fact is, we demand that they provide proper care for her. If they don't know what's wrong with her, send it to Stanford, send it to another institution where they can find out. This is a basic right, a basic human right. And one of the things that we want to discuss now is Kaiser is actually going to England to help their healthcare system, supposedly. And we have with us Carolyn Malloy, who's an expert on healthcare system in Britain, and she has a few words she would like to say in solidarity with us.
Thank you very much. I won't speak for very long, but just to say that I'm incredibly moved by your story and angered. This would not happen in England. Someone would not be being tried to be discharged in this kind of medical condition, and you do have the right to second opinion. I'm not saying things are perfect, but what is alarming to me, the reason I've come here today is because our government, our right-wing government, is saying that we want to have the kind of budgetary arrangements that they have in Kaiser Permanente applied to England's National Health Service. And England's National Health Service executives are coming over and visiting Kaiser all the time to learn about how to run healthcare. And from everything I've heard today, this is not how to run healthcare. There's a lot of talk about overuse and trying, some of the stuff around discharge and early discharge. It feels to me like they're trying to learn from an approach which is completely inhumane. And I'm really pleased to be here, and I hope that we can talk about your story back in England as well.
I was at Stanford Hospital. I like to spend a lot of time with my wife, but they've kept me so busy filing complaints that I've not been able to be here a lot. Luckily, my daughters on the weekends and after work, they come and spend time with my wife. My mother-in-law is upstairs now with her. And I was at Stanford Hospital last Thursday and Friday, and I talked to some very caring people there. And they have actually a specialized group called the a consultative medical group, a group of doctors that review medical records and see patients that have complex medical issues that have not been resolved. And they said they would be happy to see my wife if Kaiser did a referral and pay for her to go down there and transport her down there. And whatever they find, they'll have to explore if it's, brain, GI, and they have a GI motility expert down there. So they said they're willing to see my wife, but the stumbling block right now is Kaiser is not willing to do anything else. Kaiser wants to discharge my wife, not to a nursing home anymore. They discontinue her therapy. They want her to die. They want her to die.
So